Everybody, Nick Thompson, vet here. They call me the gut doctor on a good day, and I really want to welcome you to our discussion this evening. We're going to be talking about Cushing's disease. Okay, so Cushing's disease, hyperadrenocorticism. That's Cushing's disease. Hypoadrenocorticism is Addison's disease. It's one of those things. It's one of those historical things where the person who discovered it is actually discovered by a guy called Cushing's quite late, about 1910 or so. And he described it, and it's lived with his name ever since. In veterinary medicine, though, we're kind of moving towards, and I don't like it, I quite like the name Cushing's, towards hyperadrenocorticism. But there you go, it's not that important. How are you? I hope you're well. It's been an absolutely beautiful day in this part of the world. I've been driving around in the Cotswolds, which always makes me happy because I grew up in the Cotswolds. Really busy day. Started very, very early, but a very good day. We've got a lot done. We are going to be talking about Cushing's today, but on March the 20th, that's just less than a month from now, we are going to be talking about skin and coat. We're going to be looking at all aspects of skin and coat and how herbs can influence those things. And I think we might even bring some mushrooms into the discussion as well, because they're becoming more and more prominent in conversations that I have. So I think without any further ado, I hope you are very well and you've had a good day. Penny van der Merwe. Sorry, Penny, I probably just murdered your name. Van der Merwe. Don't know, sorry. Reminds me that I was going to tell you, very, very exciting, the Raw Pet Medics, along with Anna Heim-Bjorkman, who is the professor at Helsinki University, who's doing a lot of research on raw food. The four of us are going to be traveling down to South Africa. Penny says, yes, I did murder her name. I apologize, Penny, but maybe see you in South Africa in a month's time. So we're going to be in Johannesburg on the 29th and 30th, talking about raw food. Loads of vets coming. I think there may be some places left if you want to chase that up. If the company who is organizing things is Pawsome, as in Pawsome Raw, they're in South Africa. Retha is the owner and the chief instigator of all these good things. So she's organizing things. Penny will be there. Great. So Penny, that makes up for me murdering your name. Okay, so we're going to be in Joburg 29th and 30th, and then we're going to be going down southwest to the Cape Winelands, which sounds very interesting for obvious reasons. We will be sampling some of the herbal deliciousness down there, that's for sure, and we will be there on the 5th of April. So I'm telling you that because it's exciting. Okay, it's all about raw. We're going to be talking about health. We're going to be learning and sharing ideas with our colleagues in South Africa. Very, very exciting indeed. Okay, so plenty of time for everybody to jump on board. Let us go to let's see if I can remember how to do it. I haven't been with you for so long. Let me just go like that, and then if we go like that, and then we just say to Laura if she can give us a thumbs up. Laura is keeping everything straight today, and if she gives us a thumbs up, then I know that you can hear me and you can see the image, and I hopefully am down in this little corner down here. Hello. Okay. Lots and lots to share with you. And what I've done is I've dug out loads of kind of ancient folklore about the herbs that we're going to be discussing tonight, because I think that's always really fascinating, because it strikes me that if a herb was well used in antiquity, then it's likely that it's going to be very potent and very useful even today, because people just didn't have the time and the energy to go and pick herbs that didn't do what they say on the tin, you know? So I think there's a lot to be learned, and it's very interesting to see, to just kind of glance into ancient history to see how people related to these herbs. So we are going to jump into canine Cushing's disease here. Okay, so how does Cushing's manifest? Okay, so here's a really lovely diagram, and so the cortisol, it's cortisol disease. It's too much cortisone. It's what we humans use in very large quantities as an anti-inflammatory effect. Yeah, they use it for itch and for inflammation diseases. But actually, what the body does is the body uses the adrenal glands to produce cortisone at just the right level, which helps you with stress and helps to moderate inflammation, to help with healing. And the adrenal, they are aptly called because they are added, if you like, to the renal tissue. Yeah, renal means kidneys, so adrenal, they are both perched just above the kidneys, and you can see those there. Let's see if I can find a pointer. Let me see. Pointer. Maybe not. No. Okay, can't find a pointer, but you can see them there. Okay, you can see the kidneys there. Okay, so they produce too much steroid, and that's either because there is hyperplasia of the that is they grow too much in later life, or because they are being stimulated. And where are they stimulated from? They are stimulated from the pituitary gland. The pituitary gland is in humans is about here, in just behind the middle of your forehead, and in dogs kind of between the eyes, within the brain, and it releases ACTH, adrenocorticotropic hormone, which is a kind of long-winded, posh way of saying this hormone stimulates the adrenals to produce cortisol. Okay, so two types of Cushing's. One is where the adrenals grow too big and start pumping out too much cortisone, or the other type of Cushing's, which is pituitary dependent Cushing's, where the adrenals are okay, but there's a tumor at the pituitary, and so the pituitary produces too much of the stimulating hormone ACTH, and so the adrenal glands very dutifully pump out more cortisol, not because they have overgrown, but because they're being encouraged to, instructed to. Okay, so two different types of Cushing's. It's kind of a technicality within veterinary medicine, because you've got to know which of the two, because sometimes the treatments can differ. As far as symptoms and things are concerned, they look exactly the same. Okay, so what are the symptoms? And this unfortunate dog is showing some classic symptoms. If you have a look at the dog there, the first thing you see is the pot belly. Okay, and just kind of looking exhausted, standing up. That's very typical. Kind of arched back because they're weak the muscle tissue is not as strong. The pot belly occurs because you get fat deposits within the abdomen, within the liver, and so there's more weight, but also the musculature of the abdomen is reduced, and so the abdomen, rather than being kind of a roundish shape, drops into a kind of a pear shape, the classic pot belly. And if you look at the hair on this dog, just behind, well, you know, a kind of where a saddle, if he was a horse, uh, uh, you can see thinning on kind of the saddle area there, and you classically see thinning and alopecia. On the list, we've got increased thirst and urination, steroids, even steroids that a vet would prescribe will make a dog increase thirst. We call it polydipsia, polyuria, polydipsia, where you drink more and therefore you pee more. Increased steroid in the system makes you more hungry. You're panting and kind of looking exhausted. We've discussed the hair loss, the lethargy, this exhaustion. And because having steroid in your system is immunosuppressive, you can get recurrent infections. Okay, and in more extreme, and this is where it really is quite extreme, you get calcinosis cutis, where your skin becomes infused with stony calcification. Okay, it's basically it's because of the steroid, you get the skin is bumpy and you can feel calcium deposits below the surface of the skin. Okay, and that's virtually impossible to shift. But if you can just quieten the Cushing's and reduce secondary infection, that's the key there. Diagnosis: don't panic. This is really just to highlight it. So we've got 3 lines there. If we start with the red line at the bottom, this is iatrogenic Cushing's. Iatros is, I think, Greek for doctor, and so this means doctor-induced Cushing's disease. This is where a doctor or a vet has prescribed too much steroid, taken by mouth usually, to the patient, and they induce Cushing's symptoms. And if you do a blood test, so this is saying that we do a blood test at the baseline plasma cortisol, and then about 2 hours later you do post-stimulation plasma cortisol. So you do the baseline, you then give them a shot of this stuff, ACTH, which is why it's called an ACTH stimulation test, and you get differing response depending whether you're normal, whether you've got iatrogenic, doctor-induced Cushing's, or whether you're actually you have got Cushing's disease, where you're producing too much cortisol. Okay, so if it's your doctor giving you too much steroid, you just get a flat line because your adrenals have just gone on holiday and they've just given up producing steroid because there's too much steroid in the system. One up from there is the blue line. This is the normal, and the range is that kind of fat pinky band. But essentially, if the normal dog, when you give a dose of the ACTH, you get a moderate rise, a kind of a healthy rise in response to the ACTH. But what happens with most, and not all, this is why it can be tricky, is that that when you have spontaneous Cushing's, when you have Cushing's disease proper, you will have an exaggerated increase, an exaggerated response when your body sees the ACTH and you've got this disease. You over produce cortisol, and that's the reading. But as you see, a range on the right hand side, and there is a crossover. So sometimes it's really difficult to say, has this dog got Cushing's or not. In that case, you can do other tests, and a low dose and a high dose dexamethasone suppression test, and that helps to differentiate. In the old days, this is all we had to differentiate between adrenal Cushing's and pituitary dependent Cushing's. Nowadays, you can do MRIs and CAT scans and what have you to see whether you've got changes in the pituitary or changes in the adrenal glands. But it's all very interesting. This is the stuff that we got because it was the only way to diagnose. We got a lot of the teaching us about how to diagnose these things just using the tests and the ACTH stimulation tests. So all good stuff. The treatments, pretty much the standard treatment in the UK is Veteril, and Veteril basically it just suppresses the production of cortisol by the adrenal gland. It works very well in many dogs, but there are a significant minority who just can't take it because of the side effects. Vets will watch the dose very carefully, and I tend to see cases who cannot take the Veteril. In the old days, we used to use mitotane, Lysidren, and I think maybe in the States they still use it, but it's really toxic stuff. Even in the good old days, you would wear gloves when you handled these tablets, and you had to say to clients, if you're pregnant or might be pregnant, do not touch these tablets, and then you put them into your dog, So mitotane went, and the Veteril came along. So Veteril is actually much safer than using the old Lysidren that we used to. Okay. Lots of herbs that we can use to support dogs with Cushing's, especially if they can't take Veteril. But even if they can take Veteril, the herbs can be really useful. I'm going to use Cushex, this by Hilton Herbs, as a guide to the kind of herbs that we would be looking at. And the first one, and probably the strongest for Cushing's, is Vitex Agnus Castus. Okay, it's called chaste tree or monk's pepper because in antiquity it was known, I was going to say it was thought, but it was actually known to control urges of the flesh, as it were. Okay, and that was a demonstration of how it can influence the hormonal balance of the body. Okay, in my notes with regard to really ancient, the Greek physician Hippocrates noted its ability to regulate women's fluxes, hinting at its pituitary influence, a wisdom that echoes its modern use for hormonal conditions like Cushing's. Romans called it vitex, meaning to weave, because its branches, the branches of the chaste tree, were used to craft ritual wreaths, tying it to both physical and spiritual harmony. Because they thought that too many urges were unhealthy. So Vitex is a key essential herb when treating and regulating a dog who has too much cortisone in their system. The next one that we're looking at, and you'll recognize this, I'm sure, it's milk thistle seed, the active ingredient is silymarin. Everybody talks about silymarin very much because it's liver protective. It's actually kidney protective as well. But silymarin is only one of hundreds of elements within milk thistle that are liver and kidney protective. If we look at ancient wisdom, it is said that Mary, the mother of Christ, while nursing the infant Jesus, a drop of her milk fell onto the plant's spiky leaves, leaving white veins. You can't really see it in the photo there, but there are faint white veins on bigger leaves, and hence it's called Mary's thistle. And in Latin it's Silybum Marianum. Yeah, Marianum from Mary, mother of Christ. So it's even the Romans were using milk thistle as a detox and for treating bilious and liverish conditions. So very, very interesting. Next one that we find in Cushing, for example, is goldenrod. Now, goldenrod, not really mentioned much. It's a very kind of plain and ordinary. You can see it's very common in the countryside. But it was known in the Germanic traditions as a woundwort. Okay, and that's because it has these anti-inflammatory and diuretic effects. It was used to heal warriors' battle scars, a subtle hint at its anti-inflammatory powers. Interestingly, herbalists, culpepper, as in Culpepper's herbal and Culpepper's apothecary. He was around in the kind of the 17th century, and he claimed it dried up excesses, which suggests that he may have recognized these diuretic effects that we get from goldenrod. Looks a little bit like tansy and what's the other one? Ragwort. Okay. So ragwort, pretty toxic. Tansy can be toxic, but also is therapeutic. Goldenrod is really pretty therapeutic. So be careful what you pick. Artichoke, isn't that a fantastic photo? I found that and I just thought, got to use that. Beautiful green merging into a beautiful purple. And artichoke leaf is slightly bitter. Is cooling. It's very much liver orientated because steroid, of all the organs in the body, affects the liver very, very much. It affects the skin a lot, but liver an awful lot. So helps to protect liver and is influential in digestive health. If your bile is flowing well, then that will feed the microbiome nicely, means that you can digest fat and recirculate the bile, which is critical to daily health. So these are herbs that all act together for general health, digestive health, anti-inflammatory effects, and you've got there the agnus castus, and actually is a strong regulator of hormones. Burdock, one of my favorite. You probably recognize it. You see there up in the top right. You may have some of that in your garden. Big leafy herb. If you look at the roots, they kind of look like many weeds roots. Nothing really spectacular. They look like kind of scrawny carrots, if you like, but that's where all the goodness is. And burdock is a very strong detox for the skin, and perhaps could be protective against skin infection and protective against calcinosis cutis, which is really, really important. In antiquity, we have it was called poor man's medicine, okay, because it's so plentiful and easy to get hold of, that it was used extensively by the poor folk of Europe. In Shakespeare's As You Like It, there is a metaphor for stubborn attachment, because the burrs of burdock, so this is dock, like dock leaf, but this is the burdock, because the burrs will link and attach to you. Very much a very strong detoxifier. I always think of it as the JCB of the skin of the herb world, which is not quite as elegant as perhaps Nicholas Culpeper would have said. Cleavers, one of my favorites. I mean, it's about as simple as it gets. It's about as ubiquitous as it gets in herbal. Everybody knows cleavers. Spelt interestingly, cleaver with EA or cleaver with an I. Lots and lots of different names. In fact, if you look in some of the older texts, there are perhaps 20 different names for it. Sticky Willy is one of my favorites, and Gallium aparinate is a very potent lymphatic tonic. Your lymphatics are those, they're just really delicate, very transparent vessels. Blink and you miss them when you're doing dissection, but massively important, because your blood moves, your heart moves blood to your tissues, and that pressure then and the movement of muscles and what have you takes the blood back to the heart. But there is a slight loss of fluid in the tissues, and what the lymphatics do is they clear up that kind of extra juice within the tissues to maintain the fluid balance of your muscles. And you know that when your lymphatics are not working properly, because you get a great big fat leg. Horses get lymphadenitis quite a lot, unfortunately. People get lymphadenitis, and you get this edematous leg. So lymphatics, very delicate, very subtle, but you really know when they're not working, and in Cushing's, circulation and fluid balance is compromised. So cleavers very much indicated for lymphatic support, and they have a mild but significant anti-inflammatory effect as well, which is brilliant. Final one here is goat's rue, which is very interesting. And in the ancient world, throughout Europe, they would give this to cattle and to goats because it would help to increase milk production, which is very important. If that's is one of your few sources of nutrition. They recognized it was used for the treatment of what they call sweet blood, and this is where you've got increased glucose within the blood. We would now call it pre-diabetes, metabolic disease, and what have you. And this is the strength of goat's rue. It helps to control that blood sugar. How they found out that the blood was sweet, I dread to think, because the thought of being a doctor and having to taste people's blood, I bet they did. I mean, they tasted urine. That's why diabetes mellitus is called diabetes, honey diabetes. Mellitus is for honey. So I guess if that's one of the only diagnostic tests you've got, you use it. We are very squeamish these days. So there you go. Goat shrew, fascinating, helps to balance the blood sugar. So those are herbs. I just wanted to share with you. I've had quite a lot of success with Cushing's in horses, ponies, and in dogs using homeopathics. Now, the homeopathic approach is to give a constitutional remedy, but some of the remedies that my colleague Mark Elliott, who's here, who's brilliant vet, brilliant herbalist, brilliant homeopath, and he worked out that these 3 remedies can be very, very useful as a specific for treating Cushing's disease. Quercus robur is the English oak. Uranium nitricum, believe it or not, is a remedy that is made from uranium, i.e. the stuff they make atomic bombs from. And ACTH, obviously, is adrenocorticotropic hormone. So that's a more obvious one. But where good old Mark found Quercus and uranium nit from, I don't know. But fabulous remedies when one is treating Cushing. So if you've got a dog or a horse and you can't take, in horses they use a drug called Prescient, which has a similar effect to the Veteril, which is what we use in dogs. If they can't take those, or you want to try and move away from the Veteril, the pharmaceutical treatment for Cushing's, then homeopathics, I would be using herbs and homeopathics if I was when I treat Cushing's disease. Okay, so that's us for the show. Let me come back to you there and go like that and just see. It looks like I've got a very slight kind of soft, you know, in the 70s they had those soft focus. I promise you I haven't put a soft focus on. I don't even know how to put a soft focus on here, to be honest. There we go, guys. That's just a little wander through a fascinating and potentially debilitating disease, which can respond very well to homeopathics and to herbs. You now know that we've got 3 options to treat. There's the Veteril in the UK. We've got herbs, and Hilton Herbs have the Cush X, and we've also got homeopathics. So you heard it here first. And Penny, I think she's got over me. I'm killing her name. And she said, that was no, I'll show you if you like. I'll show you how good I am with this machine. There we go. That was super helpful. I'm definitely feeling more empowered to deal with Cushing's clients. Great. That's really kind of you to say. Penny is a powerful vet in South Africa, and so that's praise indeed. I really appreciate that, Penny. Really, really good. And Diane is saying nice things as well. So I really appreciate it, guys. It's a joy. It's lovely. I could talk about this stuff all night. I won't bore you any further. Dinner is awaiting. And Monica says, oh gosh, everyone's coming out of the woodwork now. Monica says, collinsonherbs.com. Very good. I don't know about them. I suspect they may be in the States with the .com, but that's something to look at, guys, if you're interested. And Martina, hiya Martina. We met her in Williamsburg, and Raw Feeding Veterinary Society. God bless you. And guys, Raw Feeding Veterinary Society, we are having a spring clean, and so please come along and support us if you're keen on raw and health, and want to be part of a family. Please come and join us. And Martina, just to say hi to Martina. She is, yeah, like I say, she's about an hour from Williamsburg in Virginia. And so, hiya, Martina. Good to see you. And great. That's me. I'm done. It's been a long day. It's been great to talk to you. 20th of March, we've got Skin and Coat, and then a week after that, we're going to be down to see Penny in South Africa. So you guys, Monica says Collins and Herbs are in Yorkshire. But Monica lives in France. Okay. I used to know somebody called Ellen Collinson. I wonder if she was very, very clever herbalist. Yeah, Ellen Collinson. I'm not sure if she's around. If she is, hi, Ellen. I'm gonna go, guys. I could ramble on like this for the rest of the evening. I won't. I'm going to say a big hello and a big goodbye, and look forward to seeing you on the 20th to talk about skin.